Hello, everyone. Welcome to Zim Ladies Roundtable. I am your co-founder and co-host, Dr. Taffy, and I'm joined by co-host and co-founder Tino. And today is special because it is Gynecologic Cancer Awareness Month. I've been practicing that word for a while, but yeah. And and we are joined, or Dr. Vita has agreed to grace us with her presence and her expertise today. So we're very excited to learn more about women's health and just everything that Dr. Vita can teach us today. So I'll start off by saying, Dr. Vita, welcome. And I'd like for you to just tell us a little bit about yourself, a little background. What do you do, sis?
Yes. Well, hey, everyone. I'm so happy to be on here speaking with you ladies again. So last time that we spoke, I was actually still working in the medical hospital system. And now I have transitioned out. So I work with a number of different pharmaceutical companies on a few different cancer products. So I do medical advising for them. I help to inform them about the other drugs that they're competing with, help look through clinical data. And I like what I'm doing now because I'm looking at multiple different types of cancers, whereas before I was just so focused on one particular type of cancer. So now I'm kind of dipping my toes and helping to create different types of drugs.
Oh, that's awesome. I had no idea you had kind of shifted a little bit, but how fitting. Look at how God works, right? Look at how God works. But how about, let's start off with, can you tell us, just a little bit about, this cancer you're talking about? What types are there, that affect us women?
Yeah, so very interesting topic. We're getting more data coming in now in the 21st century about cancers, but I'm sure many of you have grandparents and other people who just passed away and you never knew what they passed away from. So when we talk about like global incidences of cancer, you have to kind of keep in mind that you still have a significant amount of people in third world countries that don't have the type of testing and detection methods that we do have. But we have some data, and I'm going to go through the big 10 for women. And that's breast, colorectal, and lung. Those are the top 3 for women. Now for men, theirs is prostate, colorectal, lung. So we talk about lung and colorectal as just the big scary ones where you have high incidences, but then you split up the men and the women to breast and prostate. Now, 25%, it's about 25.8% of all cancers in women are breast. So that dominates the cancers for us. Whereas only about 12% of the cancers in general are breast when you're talking about worldwide men and women. So it's important to really look at the women in particular as opposed to global incidences of cancer. So like I said, the top 3, breast, colorectal, lung, and then that's when we start going into cervical cancer. And then thyroid cancer is in the middle of cervical cancer and uterine cancer. And then uterine cancer is called corpus uteri. So sometimes if you are Googling or looking around, you'll see corpus uteri as the technical term for it. And then that's when we start getting into stomach cancer. Then ovarian cancer comes in a little bit further down on the list. Then liver and non-Hodgkin's lymphoma is number 10. So you see that the top 3 in terms of gynecological cancers, you see the cervical, uterine, and ovarian. And breast, a lot of times when you look up gynecological cancers, breast still comes up because it's a hormonal cancer. The hormones are being produced down in the ovaries and they're affecting the breast. So we consider that as gynecological cancer as well.
Wow. That's heavy. That's definitely a lot of information So what sort of tools do you guys use and techniques to diagnose cancer?
Yes. It depends, right? So what I always say is, number one, the most important thing is that medical history questionnaire that you answer. Always take your time. I know we have a tendency to just rush and just check like, no, no, no. But I'll give you an example. Today, I went to a chiropractor. I always went to chiropractors, especially when I was pregnant. Before I got pregnant, that was just my thing. I always did it. I was an athlete, so I have back problems. And it's been a couple of years now since I've been in the chiropractor. So I was checking out a new one, and I was filling out the questionnaire in a hurry. They asked, everything, no, no, no. And then I go in today, and they ask me, do you ever have dizziness? And then, of course, I just put no. But then they asked again, like, are you sure? And then I thought, sometimes when I squat down and I get up, I feel a little dizzy. And then they were like, what? This was like, what? Like, what do you mean? And so they explained the curvature in the back and how sometimes if you're squatting and you're getting up and you're feeling that way, it's because there's likely a little disc that is poking out just a little bit. And so I've been to other chiropractors. I never paid attention to that particular thing. So now it's an easy adjustment. My back pain can just be essentially fixed just because I gave that little piece of information about dizziness. So whenever you fill out any medical history symptom assessment, really take your time and think,
and tell the truth.
Yeah.
And tell the, even if it hasn't happened in the past 24 hours or however long. Even if they say, have you had this in the past 90 days? If you've had it in the past 120 days, just put a note on it. Because that truly is the one that will give away a lot of information, especially with gynecological cancers. Menstrual cycle, whenever someone asks you what your menstrual cycle was, that's very important. You should be trying it. Pull out your calendar, write the exact date on there. If you have been having irregular periods, things like that, those are very, very important. Pelvic pain. If you're having pelvic pain, make sure that you're telling them each and everything. If you have pelvic pain once a month, twice a month, 3 times a month, make sure that you're letting your healthcare providers know. Then next is a physical examination. So a lot of times you can feel fibroids, cysts, all these other things. And I'm mentioning them because what is cancer? I feel like we need to go back. Like, what is cancer?
What is cancer?
Cancer is when you have abnormal cells that are growing and expanding, and they have the potential, or they are actually going to other organs, right? So if you, for example, have breast cancer likes to spread to the bones, likes to spread through the lymph nodes, to the brain. That is cancer. That's separate from a tumor. You can get just a ball of tissue growing in your, really anywhere in the body, but you can just have a lump in your breast. That doesn't mean it's breast cancer. It's just your cells something is off. Talk about that later, that triggers a bunch of cells to grow. Now, tumor, it just grows and grows. You can do surgery, you can take it out. But if it's cancer, now it can go to other organs, and that's what's dangerous, is it's now going to your brain and liver, lung, all these other places. And so when we're talking about these pelvic checks, you can feel lumps, you can feel bumps. It doesn't mean they're cancerous, but at least if you're feeling something, then that is an indication for further testing. So definitely physical examinations are important. And even before you get to a pap smear, someone putting, your healthcare provider putting a glove on and sticking their finger there, you can feel a lot. You can feel, abnormalities in there. You can feel enlargements in there. So I would say just that physical examination is important. Taking it a step deeper, pap smears are important. And actually the reason why I got into cancer is I had an abnormal pap smear. And so that led me on a journey to be like, okay, what is this that's happening? So as of now, if you are between 21 to 29, every 3 years is when you should be getting a pap smear. And then when you're older, you have a few different options. You can get a pap smear and an HPV test.
Yes.
Every 5
I was gonna ask about that.
Yep. Yeah, that's very important. So for cervical cancer, it can actually be induced by a virus. And I know we're probably going to talk later on about what causes it, but you can actually do a blood test, and then that could be an indication as well. But they usually don't. They don't just do the. It has to be part of your kind of gynecological program. Now you can ask them to do a test every year if you want your HCP to, but they don't have to. So basically, the older you get, the more frequent your pap smear test should be. And so it just depends, the HPV test versus the actual pap smear itself. And then also if they see something with that abnormal pap smear, they'll do what's called a leap test. And then they'll actually go in and they'll burn some of the abnormal cells from the lining. So that's kind of general. It's just like same thing with a pap smear, except for you'll feel the burning. It's more painful. And then you can just keep taking this further. You can go and get a pelvic ultrasound, and then that will really show whether or not this is just an ovarian cyst or ovarian cancer. It will show fibroids. It will show any other structural abnormalities. Then also mammograms are good for breast cancer as well. But you can keep going. Biopsies, hysterectomies, hysteroscopies are done. MRI, CT, things can get really, really aggressive. But I would say for most people, the things are that medical history questionnaire, just a physical exam, somebody, your OBGYN really sticking their finger in there, and that pap smear test. The three are very important for every woman.
Wow, that's really great to know, Dr. Vita. So you mentioned HPV. A lot of people don't actually know what HPV is unless, their doctor has explained it to them, or they've done their own research. But we know there are also people that have never been to an OBGYN. So what is HPV?
Yes. So HPV is actually a virus. Interestingly enough, I was supposed to actually go to Zimbabwe to do a project in a lab, a cancer project, but other things happened, and I had to stay and do another project here. And then I was looking at the incidences of gynecological cancers there, and I saw that you have at that time, this was 6, 7, 8 years ago, they had crazy high rates of cervical cancer, and they were almost all HPV induced. And so HPV it has different types, but it's essentially a virus that goes in there through sexual contact. It can also be through other ways as well, but mostly through sexual contact. And then it goes into your cervix, and then it enters into the cells there, and then it changes the operations inside those cells and causes the cells to grow so that the actual virus can infect more cells in the cervix. And so most cervical cancer is HPV-induced cervical cancer. Now here in the US, they had an initiative. I have very strong feelings about it for another day that we can get into, but around 2005, 2006, they really started pushing the Gardasil vaccine for sexually active girls to get it to reduce the incidences of cervical cancer and HPV. And so their thinking is if we vaccinate ahead of time, when a woman then has intercourse, they'll have the antibodies to prevent this virus from causing cervical cancer. So essentially, long and short, HPV is a virus that can induce cervical cancer. And we found that there are very, very high incidence rates in communities that have high STD rates. So that's why at that point I saw these crazy high rates in Southern Africa of cervical cancer.
Wow. Wow. So is it curable? Is there some, say I go to the doctor and they tell me I have HPV today, is there Is it curable, or am I, looking at, when is cancer going to happen, or, what are we looking at here?
Yes. So they can vaccinate you, depending on, how aggressive it is, when you actually contracted it. For the most part, you can get vaccinated and you should be good to go. Now, if we're at the stage where we have cancer, if we have the abnormal cells now, yes, you can still get that treated. You can get the LEAP procedure and that's fine. If you have cervical cancer, now that's a whole different, now it's not about the HPV. Now it's about actually curing the cervical cancer. If it's spread to other organs, the other organs beyond your uterus, then sadly, there may not be many options. You would have to go through chemotherapy depending on how aggressive it is. But if it's just contained within like the other tissues within the uterus, you can have a hysterectomy, and that would save your life. So it just depends on what stage you're at.
Okay. I remember the last time I went to the gyno, I always ask questions because they're always, every time you get in there, they say, "Do you want to get vaccinated?" And I'm like, "No, I don't think it's necessary." But one of the things that they always mention is if you ever do contract HPV, is maybe your diet also plays a factor into it. If you do like the lighter version of it, is that true, or how does that work out?
That one I'm not sure of.
Okay.
I'm not sure about diet affecting HPV.
Okay.
I'm not familiar with that.
Okay. Mm-hmm. Well, I guess I gotta read some more.
Yeah.
Okay.
So you mentioned. Sorry.
Once you're infected with any kind of STI, from my understanding, and I'm not perfect, and we're learning new things every day. Look, we used to do this every year, and now we're just extending things. And medicine does not know everything. But for the most part, once you have an STI, it's very hard to reverse it with diet.
So, so I know it's difficult to give us specific symptoms for each and every cancer, right? But are there some, I know you mentioned pelvic pain, or some breast pain. What other major signs and symptoms should we look at where, if I'm feeling this, definitely go to the doctor. Go get it checked. Don't try to self-medicate, because we know there are people that like to self-medicate, especially the men. What signs should we be looking at?
Yeah, so this is cancer dependent. So I can kind of break it down depending on the cancer type. So cervical cancer, it's your cervix, right? So this will be abnormal vaginal bleeding, especially between periods, right? So yes, if you have extremely heavy periods, it isn't necessarily cervical cancer. It could be fibroids, it could be other things. But if you have bleeding in between periods, then that's definitely a red sign. If you have bleeding after intercourse, that's a problem for cervical cancer. If you are postmenopausal and then you're bleeding, then that's also a sign. Actually, it's more of a concern after 50. Women after 50 are really at risk of getting cervical cancer. Now, a lot of this is because, as you all know, when you are on your cycle, you're shedding that lining. After menopause, you're not shedding any lining, so that really, you're more prone to getting cancers forming there. So definitely very, very important. If you have that bleeding in between periods, look, cervical cancer is one thing that I would think of. So I already mentioned pain during intercourse. Any kind of pelvic pain during intercourse, even if it's not specifically down there, anything a little higher, that's usually something that you should bring up to your healthcare provider. Unexplained back pain, unexplained pelvic pain, that entire area, you know, you start to run into some irritable bowel syndrome, some other things could be going on, but it could also be one of these cancers. Definitely pay attention to your discharge. It could be, it's just the yeast infection, it's just bacterial vaginosis, but it could be something more serious. So a really foul odor is leaning more towards one of those cancers, particularly cervical cancer. Anytime you're having painful urination or blood in the urine, this is less common. Actually, one of the main cancers that I work on are like the cancers of the bladder, the urothelial cancers. And those actually, I'm finding a lot of cross-link between some of these gynecological cancers and the urothelial. Now, they're not as common in women, which is good because they're devastating. But yeah, anytime you have issues with that urination, it could be the cervical cancer, it could be any of the bladder cancers as well. When we start to go to urine cancer now, this is when you have an enlarged uterus. If you just feel like something is heavy there, it could be fibroids. When in a pelvic exam, if fingers are put in there and you can really like immediately feel that uterus, then a lot of times that's pointing toward uterine cancer. Unexpected weight loss is also common with uterine cancer as well. Super heavy periods are also related to uterine cancer. Irregular periods, not as much bleeding in between periods, but irregular periods typically tend toward uterine. And then I can touch on ovarian as well. Not as common, though. It's more towards the bottom of that list, but it's still the top 10 of cancers for women. This one is typically you're really tired, loss of appetite, unexplained weight loss, frequent urination, not necessarily blood in the urination. That one is more towards uterine cancer. But if you're just like urinating consistently, it could be something else, but bring it up to your HCP because that is something that's noted with ovarian cancer. Also, bowel movement. So if you have constipation, diarrhea, you know, that's something that you could just feel dismissed. You can easily dismiss constipation and diarrhea. But that's something we need to look into as well for the ovarian cancer. Now, there are also other types of cancers like vulva cancer, vaginal cancer. Those are also in there as well, but very uncommon. Vulva would just be outside, so the little area outside, that's the vulvar cancer. Vaginal, not too common.
I know I like a drink here and there. So is alcohol a big risk factor? Can we continue to have our beverages or should we be cautious?
Yeah, not anything in moderation, but if you're drinking a glass of wine with your dinner, that has not been shown to like accelerate cancer in any way. Now, if you're, you know, getting drunk off the goose every day, then I highly recommend you not do it.
You might have more problems then.
Yeah. So with wine has benefits to it. So if you're gonna drink, I highly recommend that you go with wine. A cocktail every now and then is not going to hurt anyone, but for sure, if you're alcoholic, if you have any drinking problems, if you drink very frequently, that's something that I would discourage.
So are there any other things that we should avoid as women? But actually, before you even answer that, I don't want to miss the question in the comments that they're asking what's the common type of cancer for men?
Yeah, so for men, we still see the colorectal and lung are at the top, but prostate is in there as well. So the way that you should always think of it, colorectal and lung are the most common for men and women. And then you bring in a hormonal one. The most hormonally sensitive cancer in women is breast cancer. The most hormonally sensitive in men is prostate cancer.
Mm-hmm.
So those are the big three.
Okay, thank you. So back to my question, what other things, foods, activities, what things should we avoid or just enjoy in moderation apart from alcohol? For both women and men.
Yeah, so people who have insulin sensitivity are more prone to cancer, right? So you're a diabetic. If you have any issues with insulin whatsoever, then you're at high risk, unfortunately. So the way to do that is to prevent ever being in that position. Although, diabetes can be hereditary. For most people, it's not. For most people, it's your choices in eating. So you can do this by eating low glycemic index foods. I'm a big believer in enjoy yourself. Like, you shouldn't just be like, eating this like rigid diet all the time. You should enjoy yourself. But definitely for cancers, people, they feed off of sugar. So if you're going these carbs and sugars, it's better if you eat low glycemic. And what does that mean, right? So what that means is whenever we eat any carb, we need to store it in our body. And we have insulin that's there that allows those carbs to enter into our cells, into the cells of our bodies. There's certain foods that you can eat, like if you eat a potato, then it's going to spike your sugar. I mean, it's a heavy starch. It's going to really spike. White bread will do the same thing. Really, a lot of the white carbs. There's just so much of the sugars in your bloodstream that it's a lot for your body to take. And so in the long run, your insulin is just working so hard that it becomes like desensitized. And then you have to actually take insulin if you're diabetic. So if you take low glycemic foods instead of white bread, you could do whole wheat bread. I prefer you not do any bread. But if you're going to do bread, you do the whole wheat bread. If you're going to do, instead of white rice, you substitute the brown rice. Different changes like that. If you Google low glycemic index foods, there are plenty of foods that you can substitute. Maybe quinoa instead of rice as well. It's even more low glycemic than brown sugar. So these are better because they don't spike so much of that like insulin response in your body. And so actually they have done studies. This started coming out really 2015. This was hot. This was like the way to kill cancer is remove all of the carbs from a diet. And I actually was one of the people. I did this with mice, where we would have mice, we would give them cancer, we would restrict all carbs, and the tumors would shrink. So really limiting, like I said, have fun, eat what you want in moderation, but every single day you should not be spiking your insulin. And I see some saying Google it's low glycemic index food. And there are plenty of substitutions.
And yes, Faith, it is recorded. We're going to post this on our YouTube channel as well. And I'm really trying to avoid asking about fibroids because I feel like fibroids are a whole conversation. Like we need a long time for fibroids, but 2018, from my experience, 2018, they found, a big fibroid. Well, they thought it was the size of a golf ball. Well, softball. They thought it was the size of a softball. But when they cut me open, basically, they realized that it was pretty much the size of my head. And, after surgery, I guess they do a biopsy, or I don't know if you call it a biopsy, but they check if it was cancerous and all that. And so after my surgery is when I realized, from talking about it, that there are a lot of women who are going through the same thing, right? And I hope we can, have another session with Dr. Mona. She's also had her experience with fibroids as well. But could you just touch a little bit on fibroids? Just what are fibroids, and how do women know that they have fibroids?
Yeah. So fibroids, essentially, we're talking about like a tumor. So this isn't cancer. And actually, the bigger the fibroid, the less chance that it could be cancerous. So if you're going to have one and you have a big giant one like your head, then you know that it's not. So those cells are staying there. They can't move to another organ. So that's not a good thing, but better than it being cancerous. So yeah, with regards to the stats, I don't remember the stats particularly for fibroids at the moment. It's been a couple years since I've looked at them, but essentially this is just an overgrowth of cells. Fibroids love sugar, that's for sure. They're difficult to shrink, but they are shrinkable. I've seen it, I've experienced it. It just takes a long time. So it's basically just an overgrowth in areas. Now, where you could run into a serious problem, most people can live with fibroids and they'll be just fine. This isn't something where you're going to die from fibroids or anything like that. Very, very common, particularly in African American women. They're starting to see more incidences in Africa, but we need better diagnostics to really get the data on that. Where the problem comes in with fibroids now is the pelvic pain, which we are strong women. A lot of us just tolerate it, move on about our lives, which is sad. But the pelvic pain is one thing, but also pregnancy. It could be, depending on the location of the fibroids, it could prevent conception. It could also cause issues and complications during pregnancy. There are women, many women, thousands of women that can be pregnant, have a safe pregnancy, and have fibroids. It's there. So yeah, I would say the two biggest issues are the pelvic pain and the pregnancy. Usually heavy periods accompany them. And so not as common as the pelvic pain, but yes, there are women that have extremely heavy periods. They're changing every hour or every 30 minutes. They're not, if it gets to that point, absolutely, you need to consider surgery or something like that. But if you have fibroids, the answer is not always surgery every time. Explore, look at the sizes, the locations. Are you going to try to have a baby? Is this going to cause any issues? I don't recommend you getting pregnant when you have fibroids. I'm definitely not saying that. I'm just saying that many women have had healthy, safe pregnancies while they have fibroids.
I have a cousin who has suffered from fibroids really bad. She had surgery, and then I think her doctor got to a point where they were going to try to laser them because they kept growing back. Is that something that, I mean, nothing is ever safe, but is that something you would recommend for someone who's had trouble each time they've had surgery with regrowth?
Yeah, I have a different view. I don't recommend surgery as the first option. I've seen them being shrunk naturally with some hard work, some discipline, and time. It depends on her situation. It depends. I think conception is a big thing. Is someone trying to have a baby? Because anytime you cut the fibroids off, they're just going to grow back. You're just going to accept that. Lifestyle modifications can help depending on the person, depending on the location, depending on the situation. So it's one of those personalized things where I don't recommend like just one thing for every person. It's going to be different.
So would an alkaline diet be something that could be helpful?
It depends on no, I'm going to say no. that and other things, but if you're growing these tumors, you have to figure out why, right? So this isn't everybody should eat this particular diet and drink a particular pH water and that's going to cure everything. I'm going to say no.
So is there we keep hearing, or it keeps popping up on my Facebook timeline, endometriosis. What is that? Is that the same thing as fibroids? Is that what's endometriosis?
Yeah, endometriosis. Oh, it's very, very sad, actually. So let's talk about just gynecological issues in general. If we actually look at gynecological disorders, we'll find that cancer is actually not at the very top of the list. So if you're talking about gynecological disorders, the most common are irregular period, menstrual issues, menstrual disorders, issues with women's cycles. That is a disorder, and that's the most common. So that's number one. Next is PCOS. So PCOS, another one of those where if you have PCOS, really carbs could be an answer. I know plenty of people that have limited high glycemic index foods, and they've been able to reverse their PCOS. So polycystic ovarian syndrome, that's PCOS. That's essentially when you're forming cysts in your ovaries. And this is accompanied by very irregular periods, pelvic pain, trouble getting pregnant, usually obesity accompanies it, or it precedes obesity, but that's not all people who are obese. You could have someone with perfect weight who has PCOS. So actually that's up there on that list. And then you're talking fibroids next. You see fibroids more in women of color. PCOS, you see that across the board. Tending a little bit more on women of color, but you see that really across the board. And then after fibroids, then we start going to the endometrial cancer. And then vaginitis actually is very is on that list as well. So these are vaginal infections, inflammation, and then ovarian cysts are next, not polycystic, but just people forming spontaneous ovarian cysts. And then pelvic inflammatory disease is next. And then after that, it's endometriosis. Inflammatory disease, really it's among sexually active women, and it's just inflammation in the pelvic area. Now, endometriosis, I've heard the most painful stories come out of endometriosis. It's essentially when you have extra tissue growing in the lining of your endometrius. This causes significant pain during your menstrual cycle, because during your menstrual cycle, you're shedding some of that, but you're shedding like tissue, like very thick tissue. It's extremely painful. Women who have endometriosis are often bedridden for a number of days during their menstrual cycle. It's accompanied by fertility issues. Having children earlier in life, they've seen actually they've shown it can actually reduce the incidences of endometrial cancer down the road. But yes, my heart really goes out to women that have endometriosis. And it's so painful because we don't have a cure for it. It's just, they end up under surgery after surgery, and it's just very, very painful to watch.
And I mean, with those, like I mentioned, it keeps popping up on my Google, my Facebook, but they also mention hair relaxers being one of the causes. I think there's a lawsuit right now that's going on about, on hair relaxers and cancer, gynecological cancer, endometriosis, fibroids. What's your take or your experience when it comes to, the connection between hair relaxers and women's reproductive issues?
Yeah, it's been years since I looked at that, but that's nothing new. I can remember going all the way back to 2009, 2010, this being like it coming out saying that these hair relaxers are causing issues. Now, the actual mechanism by which they cause these problems has yet to be verified, but absolutely there has been a link between it's not saying that just because you get a hair relaxer it causes these gynecological issues. The point is women are the ones that predominantly get these hair relaxers, and so it causes issues with hormones. They're endocrine disruptors, and so the endocrine system is what produces hormones, and so they've seen that these hair relaxers are actually causing disruption of hormones, and so that's when it tends to affect these gynecological cancers because they're based off of hormones. But the exact mechanism of how it works, how long, how many relaxers you have to have, how many years, all the specific, you need funding to be able to do like a thorough investigation of that. And so everything that we have now is just, you're just guessing, you're thinking this or that. But absolutely, hair relaxers are very, very dangerous, and there should be companies that make them.
Dr. Vita, with everything that you have told us today, what should we what should we do to limit our risk factors? Some things we can do with diet or just even lifestyle in general, in order maybe we might not be able to avoid it because of genetics and whatsoever, but what can we do just to make sure that we can do our best as we live?
Yeah. The good news is if you're under 50, your chances of getting these gynecological cancers are low compared to after 50. So number one, age is a big thing. Once you're after 50, you really need to pay extra attention. Family history, you need to know what your great grandma passed from, if you can. I know where I'm from, a lot of times they're just like, they just died, or they just, whatever. But really digging in. I know some of these may be taboo in certain cultures, but it's important to figure out what your grandma, great grandma, whoever is passed on in your family, it's important to know what they had, because gynecological cancers actually are mutations that you can get from a relative. So family history, along with that, genetic mutations. So some of this is inherited genetic mutations like I just discussed, but also our lifestyle can actually alter the genes that are expressed in our body. So you have some, for example, how some of your organs inside of your body are made. Those genes are expressed, and it's exactly like what you were born with is how it is. But there's certain genes that can actually, your behavior can actually change how certain genes are expressed. So if you can try to eat as clean as possible, avoid processed foods. I always tell people, be careful what you put on your skin. Be careful. Just get rid of stuff with dyes, especially consuming stuff with dyes. Try to just be as clean as possible. I like the Environmental Working Group. They've done great work in terms of cosmetics. And so you can go ewg.org. They have a tool on there. I actually have the app on my phone where you can scan. Anytime I'm about to buy like toothbrush, toothpaste, hair supplies, hair products, I'll scan it, and then it'll tell me if there's any ingredients of concern. Now, when I first remember hearing about this relaxer thing, a few years later was the natural hair movement that just popped up. And then, yes, we removed the relaxers, but now it's your co-washes and all this, whatever, washing toxic chemicals, which is, okay, you've just switched from having your relaxer every 6 weeks to now you're putting chemicals every day. So that's also a concern of mine. So clean eating, clean living. Like I said, enjoy yourself. And absolutely enjoy yourself. Try to eat as clean as possible. Avoid processed foods. Shop the outside of the grocery store. I'll do you one better. Shop with farmers. Go to the actual farm. Farmers market. Farmers markets can be expensive, but you can go to the actual farm itself. And that's very important. I also do want to add that women, we should be very, very careful in terms of our sexual encounters. Of course, because of my faith teaches that we should wait until marriage to have intercourse, which is ideal. But if you're gonna have, do what you do, definitely protect yourself against STIs, sexually transmitted infections. Now it used to be STDs, sexually transmitted diseases, but now the industry is switching to sexually transmitted infections. Either ones are fine, but STIs are becoming more common. So please, please be careful. Pretty please, just protect yourselves. Make sure it's with the right person. Yeah, those are the major risk factors.
Thank you so much.
Thank you.
We appreciate you coming today. We really love you. You're a good resource for us, even just for us personally. I know when we have problems, we're like, Dr. Vita, what should we do?
Anytime.
So thank you so much.
Oh, this is awesome. We definitely need to get back and do this again. Have Dr. Mona. Hopefully, our scheduling we can align at some point.
Yeah, that'd be great. That'd be great. Well, thank you all for all that y'all are doing, especially for our community. You're awesome. Thank
you so much.
And we thank you for what you're doing.
What should we look forward to in the future, and where can we find your information if people want to look you up or use you as a resource?
Yeah. Unfortunately, these days I am with the pharmaceutical companies. I used to devote more of my attention towards the general public, but I work with pharmaceutical companies. I always have to be careful what I say.
Right.
They're developing this, and I know that they're developing this, and I'm not allowed to say it, and blah, blah, blah. So I don't do as many speaking engagements as I used to. I still do them once every month or a couple months. But Instagram is a good place. So you can follow me on Instagram at Dr. DRVITAK. I'm responsive most of the time. I may not get to you immediately, but even if it's a month later, I'll get back to you. You can also look at my YouTube, Dr. Vita Natural Health. There are dozens of videos about different topics. I plan to record some extra stuff. I've just got some contractual situations, and I don't want to talk too much about what I know.
Well, when you're able to, please hit us up so, we can do this again, and you can let us know what you're working on or what's out for us, what we can do to better our health and, our families. So that, just we want you to come back. You're a resident doctor, so.
Well, thank you everyone for joining us tonight. As always, like and share and follow our Instagram. You can also go to our YouTube. If you have anyone who didn't join us, they can always catch it on YouTube, which is ZimLadiesRT. And then you can also catch it on our website, which is ZimLadiesRT.com. Thank you, everyone, for joining us again.
Thank you. Thank you, Dr. Vita. Thank you, everybody.